Okay, good morning, everybody. We're here for our daily briefing from the city of Albuquerque in central New Mexico on the coronavirus and related items. So as usual, we're going to focus on a couple of topics. I want to let folks know today we're going to especially focus on enforcement and on public health. And so we have three guest speakers who are going to feature today, and I'll introduce them. But one is our Lieutenant Ray Del Greco from the police department, talk about enforcement. Also, our Deputy Fire Chief Emily Jaramillo to talk about some operations and PPEs. And then also our own Medical Services Director from AFR, Dr. Pruitt. And so lots to go over today. Let me begin with some updates from our sort of Central New Mexico Joint Information Center. But I want to preface these by saying that we do believe all across at least Central New Mexico that everyone's efforts are making a difference. And I think if we all, no matter if you want to watch the news or look on all the websites, we actually, relative to cities around us, big cities, are doing very well, and that's a good thing. Now we have to continue because let's remember that we're also behind the timeline of these other big cities. So it's very important that we keep this up, but also want to let folks know for a large city, Albuquerque is actually doing pretty good. So here's some other items for today. Starting today, the Unemployment Insurance Operations Center is extending hours. I know this is something we've gotten a lot of calls about. And it's great they're extending these hours. So they're going to be open from 7 a.m. To 7 p.m. now. And of course, internet access is strongly encouraged. But I know there's been a long wait there, so hopefully these new hours will help. Also, the Workforce Solutions Department is waiving the waiting week for claimants for everyone who's applied for benefits since March 15th. And they're also beginning a new program this week that will clear specific pending payments issues systematically rather than one by one. So hopefully these changes are really going to make a big difference. I know they're experiencing higher volume than ever before, and so we really appreciate their trying to step up and accommodate that volume as best they can. Also want to let folks know that UNM and a network of 3D printers are collaborating on design and deployment of protective gear. I know this is something our whole country is dealing with, but a lot of local businesses are also stepping up. And so want to thank those businesses that are doing that out there. And we're trying to fill in the gaps left by the federal government on this one. A couple of updates on our micro grant program. As we shared yesterday, I think we're going to have the recipients of those announced Friday and maybe another batch on Monday. So stay tuned, and those checks should all go out next week. And again, those were oversubscribed 12 times over. So we're grateful there's 100 or so folks we can help, and we wish we could help a lot more, but if folks want to donate to the One Albuquerque Fund, that's a great way to get those monies back to our small businesses to keep them afloat. All right, also want to mention a little bit on banking on the economic front. We're getting a lot of calls, everyone is, about the PPAs. This is the federal program, Payroll Protection Assistance, and about how difficult this is to get for our local businesses. And I know there's been some national news with respect to how big banks like Wells Fargo are handling this and so forth. I want to encourage everyone to, if you're having a challenge with your bank, try another local bank. I have heard that several local community banks and credit unions are processing these applications. So again, I think the main lesson is if you're rejected, try another bank. And so right now there are several community banks still processing these applications. It's a good thing for our community. Also want to highlight the banks that are really stepping up with their own loan program locally because it's just easier to access. I know Nucenda's been one with a very good program. I think there are some others. These are great examples of our local banks really stepping up. Now let's talk a little bit about enforcement. I know that the new reality and these state orders are certainly challenging. I know they're very tough on businesses and in many ways can seem uneven or unfair, but they're extremely important. And we're trying to do the best that we can to keep everyone safe. And I know that there really is I want to remind everyone that the goal is we're trying to save folks' lives. And I know as a city, we're trying to keep as many essential businesses open as we can by supporting them. But the non-essential ones, you just have to close. It just is what it is right now based on the state orders. And so APD is now issuing warnings. They look like this. And this is if you're called, if we get a call on you for the second time. This can come from our environmental health department. It can also come from AFR and the fire marshal's office, or from APD. We have all three agencies working on enforcement on this right now. And I want to let folks know that, you know, some businesses have been resistant to following this order. I think we've heard a little bit about Total Wine. We also know that Lowe's just hasn't gotten the processes in place. You've got to measure customers. You have to do the metering. And have to means now. So I do know that we issued some warnings to Lowe's and to Conn's. And APD issued a warning to Rags to Riches Smoke Shop for refusing to close. If those continue, we will actually just physically close them off in addition to escalating the fines. So that's where we're at with enforcement. We're going to hear more about that in a little bit. And I want to also mention, though, for the big box stores, all the local employees, we're trying to protect them. That's what this is about, as well as citizens. And even the local management. This is not their fault necessarily if there's fines and citations. This is really a regional corporate issue. Corporate needs to get the message that in the state of New Mexico, and from my perspective, in the city of Albuquerque, you have to follow the rules. That message needs to get to corporate. So I do want to remind folks, the staff is very concerned about their safety, just like we all are. And so remember, with these big box stores, it's not a local issue. It's about corporate getting the message and enabling our local managers to implement these rules. And so remind folks that that's really who the deciders are in this case. And so we're going to do our thing locally, and I'm sure it'll quickly get up to corporate headquarters. So with that, I want to mention one thing on government continuity before we hand it over to our Albuquerque Police Department. We are working on our bus route. I know there's been some information out this already. And I want everyone to know, first and foremost, bus ridership is way, way down. So in general, just the notion that we're using less buses for the same amount of people is absolutely wrong. Bus ridership is way down, so we've been using the Saturday schedule. However, the Saturday schedule might not be enough, especially on Route 66. So we are adding some supplementary buses, these sort of helper buses. And the game plan is that a bus comes every 7.5 minutes, and that we're trying to restrict 15 people on the bus, which is the appropriate social distancing. So I think this is a reminder. We're going to be flexible. We're going to continue to adapt because we have to solve two goals. One, we have to maintain public health standards. Two, bus transportation infrastructure right now is critical for a vulnerable segment of our population that is using the bus very much to go to medical appointments and to go shopping. And so we're going to work through that. And right now, the latest plan, I think, is working a lot better. So now let's hear a little bit of information with respect to where APD's at on enforcement and so forth. Lieutenant Ray Del Greco. Lieutenant?
Thank you, Mayor. So my name is Ray Del Greco. I'm a lieutenant with the Albuquerque Police Department. I'm here to give you all an update on APD's response to the COVID-19 outbreak. As you all are aware that Governor Grisham's order came into effect, we are now beginning the enforcement action on businesses that are deemed non-essential through the governor's mandate. At this time, APD has conducted business checks on around 400 businesses. A vast majority of those businesses that we have conducted business checks on are complying with the governor's order, which we thank them wholeheartedly for. Again, the entire goal of this is to ensure that the COVID-19 virus doesn't affect our community as much as possible. So out of those businesses, we've found some businesses that are still not adhering to the order. With those businesses, as the mayor just alluded to, we are issuing them a warning. That warning contains all of the verbiage from the governor's order indicating that they are non-essential business and they are to be closed. After that warning, if they still aren't closing, then we will begin the citation process. I think it's important for the community to know that the Albuquerque Police Department is working hand in hand with the New Mexico State Police Department, our code enforcement team, and the Attorney General's office to be able to coordinate all of our efforts into a single entity and ensure that we're communicating and able to dispatch entities to these businesses appropriately. So For those businesses out there that have adhered to the order, again, we thank you, but we are ramping up enforcement action of businesses that aren't adhering to the order. As the mayor mentioned, Total Wine and More and the Rags to Riches Smoke Shop are some of the few that we are in close contact with, and we will continue to do so until they adhere to the order. Thank you.
Okay, thank you so much, Lieutenant. And also want to thank the AG's office for stepping up on the enforcement on the prosecution side of this. This was a key component to actually be able to enforce this, and so appreciate their help and cooperation. Let's see, next I want to introduce our Deputy Fire Chief, Emily Jaramillo, and she's going to go into some of the PPE issues and other AFR programs. Also, which by the way is a footnote which we have to mention for those of us who've been in this, I want to thank the PRC for approving our department's ability now to take folks in our ambulances direct to a hospital. So this was a big change we've been wanting for 3 years, and it couldn't have happened at a better time. And it was also an effort quarterbacked by DC Jaramillo. Come on in.
All right, thanks, Mayor. I want to start by talking a little bit about our personal protective equipment for our firefighters today, or PPE. So one of the things that we want everybody to understand is that our firefighters right now, one of our top priorities is providing adequate PPE for our firefighters when they respond to 911 calls. We do have adequate stock of all of the PPE that we need to respond to COVID-19 calls. We implemented several procedures to make sure that we not only outfit our firefighters with proper PPE, but that we're tracking the amount that's coming in and the amount that we're using. So we track that on a daily basis, so our numbers do change daily based off of what we're using and what's coming in. Right now, our supplier has demands with the federal government, and so typically those orders are filled first, and then we're able to fill our orders. But right now, we do have adequate supply for them. We're also continuing to work with the city EOC to replenish our stock. The EOC is also making sure that they are replenishing stock for other area healthcare providers like hospitals and other first responders. The second thing that I'd like to talk about today is expand a little bit about our home engagement and alternative response teams, our HEART teams, and our BLS rescue program. So a few weeks ago, in response to an increase of 911 calls for COVID-19, we determined that there was a need to basically kind of pause those programs and what they were doing with the community and rescope them as a response for COVID-19. These calls, we've been identifying potential COVID-19 calls since January 29th through our dispatch center. Our dispatch implemented a line of questioning for every 911 caller, asking them if they're symptomatic with cough and fever or if they've had any positive contact with a COVID-19 positive patient. Our dispatchers are doing a great job screening it at that level, and then they notify our firefighters to put that PPE on prior to going on scene on a call. We've been doing that since January 29th. A couple weeks ago, we did rescope HEART and BLS rescues to respond to those calls. So in addition to the response from our fire department, we're trying to get these two specialized teams out on these scenes first. We have 2 rescues that are part of this program. They have a 24/7 response, so there's full coverage in 2 areas of town. Since March 10th, 406 of our 911 calls have been identified as positive or potential positive COVID-19 patients. However, through the reverse tracing system set up by the New Mexico Department of Health, only 6 of those 406 calls have actually been positive patients. So still a very low number of these individuals that have been tested have ended up testing positive. Also, on all 6 of those calls, our firefighters were in PPE, so they did not get exposed on those calls. AFR is also working with our community partners, including Albuquerque Ambulance Services, on addressing the 911 needs in the city of Albuquerque. Right now, it's really important with a surge coming in our community that we look at our 911 services and figure out how we can be most efficient with our resources and Albuquerque Ambulance's resources to get to people in a timely manner when they call 911. Another part of that is all Metro EMS agencies, including Albuquerque Ambulance, Superior Ambulance, AMR, Rio Rancho Fire, Bernalillo County Fire, Kirtland Fire, and our surrounding pueblos and their medical directors. We meet regularly. We meet once a week to discuss operations, challenges, so that we can kind of work on this together. And then finally, the last thing I want to leave you with is just the community is doing a great job following our direction to reserve 911 calls for medical emergencies. It's crucial that we reserve hospital beds for really sick patients at this time, so we want to continue to encourage our citizens to utilize telehealth, call your doctor, call a nurse hotline, or the New Mexico Department of Health hotline if you think you have symptoms, rather than calling 911 or going to an emergency room. Let's try to continue to save those for medical emergencies. And then lastly, I saw this quote and I love it. The WHO director stated that compassion is medicine a few days ago. And I think that it's just an important thing to remember that in these really stressful times, just being a little extra compassionate to your neighbor, to those employees that are working at grocery stores, to the bus drivers, they're all still serving our community, and that is part of medicine, is just treating each other well during these times. So with that, that's it for us.
Okay, thank you, Deputy Chief. Now, our fire department is also very fortunate to have our own medical director, and so I want to introduce Dr. Pruitt to go into some of the sort of health aspects of this. Doctor?
Hello, everyone. I just want to start by saying how proud I am of Albuquerque. We are in constant communication with other cities around the country, and our leadership has been very proactive in making good decisions, difficult decisions early to protect our community, and we are doing a very good job, just like the mayor said earlier. I want to echo that sentiment. The important thing to realize, though, is we need to continue doing a good job. This is a marathon and not a sprint. We might not be able to completely avoid the virus, but the next couple of weeks are going to be crucial to lessening its impact on our community. I've felt an overflow of love and support as a healthcare worker, as being involved with first responders, and also seeing people behind the scenes working together to solve these difficult challenges. I just want to remind everybody this is a virus that's spread by respiratory droplets. What that means is if you cough or you wipe your face and then you touch a surface, if someone else touches that surface and then touches their face, that's how it's spread. So as a community, sometimes the simple things are the best answer, right? So the thing you can do to protect yourself and protect your family and protect our community, number one is please stay home. Especially if you're having cough or fever or other symptoms, don't go out and expose other people to those symptoms. But also, even if you're not having symptoms, please stay home and protect yourself and protect our community. It's very important to wash your hands, especially after you're touching surfaces. Keep your distance. Don't touch your eyes, your mouth, or your nose. That's how the virus gets into your body. I know there's a lot of fear out there. I want to reassure people that 85% of the people who get this virus do just fine and can stay at home and get well. The reason we're taking such precautions is we don't want people to get sick. We need to protect our most vulnerable members of our community. The patients who get the sickest tend to have underlying medical conditions. And so we need to stay at home, protect them, do what you can to keep people safe. As DC Jaramillo mentioned earlier, hospital resources and first responder resources are kind of tight right now. So we're asking that you limit your use of emergency services for true life-threatening emergencies. That would be difficulty breathing, changes in mentation, confusion, too weak to even get up and go to the bathroom. Those are chest pain. Those are kind of times to call 911. Otherwise, use your other resources that are available. So please call your doctor, use your nurse hotline, use the Department of Health hotline. There are a litany of services available, and please use the ones that are at your disposal. Lastly, during this stressful time, I just want to really encourage, just like DC Harmeo did, please be kind to each other. Everybody's scared. It's easy to reach out and just share love. We know that love casts out fear, and this is a time to come together as a community, protect each other, and support each other.
Thanks so much, Dr. Pruitt. Now, we also want to share with you a little bit about where you can get more information on this. There's a lot of information sites out there, and the city has a pretty good one up and running, and so it's over here. This is our Albuquerque Coronavirus Data Hub. This is a great place to look for if you need Albuquerque-specific info. I think what we've heard from a lot of folks is there's a lot of stuff even for the state that shows like by county what's happening. But if you're inside one of those counties, the question is like, what's going on? That's what this site really fixes. And it's going to be continued to be improved, but I want to mention that this is, again, supplemental to existing resources, but it provides maps and data with respect to COVID-19 in a good visual format, and I'll highlight some examples of this. It does talk about the cases and so forth, but I want to remind folks we're talking about people here, so when we see these numbers, these are individuals that some of us know, for some of us they're loved ones, and so unfortunately too, we do believe that at some point, right, this could get big enough where we all know someone who's been exposed or had it. It's hopefully not inevitable, but it's highly likely that whether it's City Hall or large businesses or police and fire, we're going to have some cases there. And that's why it's so important to share this kind of information, but also to make sure that we have processes in place so that it doesn't spread. That's the key, right? We expect these cases to show up. What we want to limit is the spread of those cases. So some information on here, and this is cabq.gov and /coronavirus-information. And this is a good example here. This is these are the meal sites right here in the city of Albuquerque. So you can zoom in and you can see which ones are near you and so forth, actually laid out on a map. And so stay tuned. This also has our 4 public health offices and so forth. So it's a great way to look too. And we've added in as much as we can. We try and do all of Bernalillo County with our partners at the county. So you see some locations out in Tejeras and Cedar Crest as well. So it's meant to be, mostly for central New Mexico. Okay, and also down in the South Valley as well, we've included all the sites there. So stay tuned for more information on that. Okay, I think with that, actually, we're going to really move into our question section. And so as we do always, and takeout yesterday was cheese and coffee. All right, so questions.
Mm-hmm. So, in regards to you're asking volunteers to log their hours to bring in federal relief, what type of volunteer work are you looking at for that?
So we have the questions about volunteers and logging the hours. If you'll go to the same site, the City of Albuquerque website, we have a volunteers portal where you can log in all the relevant information. And so we're doing a couple of things. We're connecting volunteers and areas that can actually physically connect them for socially distanced ways to do like food boxes and things like that. We're also collecting a database of folks who can help with things like public health, even drivers, people have CDLs, things like this. And so if you just use that portal, then we're going to be able to do the appropriate logging that's needed.
And do they send the information to that website?
It's a website form that you fill out on the website, and just go to cabq.gov and click on volunteer. It's right on the top. Sure.
And why is it, just for people at home, for people to understand, why is it so important to log those volunteer hours?
Well, we might be able to get reimbursement for them, but it also shows us the supply and demand for volunteers. So how many people are doing what, and then we can match with the needs for the city. So those are the 2 reasons. Okay.
Right, I have one from Jessica Dyer at the Journal. What prompts an APD check on a business? Is it a complaint, a state police referral, or is APD proactively checking on businesses?
The question is, what prompts a referral to APD to check on a business? And there's a list there that was read off. I'll let Lieutenant Ray Del Greco speak to this, but the answer is all the above. And so I do know, of course, we've issued our one citation at least already in the city. And so we are coordinating to take things from all channels.
Thank you, Mayor. Again, as Mayor Keller described, he's exactly accurate. All of the above. So we have a team of officers that are dedicated, one east, one west, that are going around proactively looking for businesses, again, that don't adhere to the governor's essential business model, or model maybe a different word, but they're not essential. So the officers are going around and making contact with those businesses. If there's some gray area, we're working with the businesses to make sure that we've properly vet whether or not they are essential or not, and then we are either issuing a warning citation if they're deemed non-essential, or we're allowing them to continue business as usual if they are deemed essential. Thank you, Mayor.
Okay, and one from QE. Have any individuals, people in large groups, not businesses, been cited?
So the question is, have any mass gatherings, large folks been cited? I'll hand it over to Lieutenant also on this, but I do want to mention we have had high schoolers, which I was in high school once too, and did the exact same thing. But I do know there's been lots of high school kind of partying at Mesa del Sol. That's one we're cracking down on and we've heard about. But others, Lieutenant?
So as far as mass gatherings are concerned, typically, and it goes for the same thing with the businesses, once an officer comes out and contacts the mass gathering or the business that's still operational, a vast majority of them are either dispersing or they're closing their doors. So far we've been lucky. The mass gatherings that officers have contacted have dispersed, and we haven't had to issue any citations to this point, but we are prepared to do so if they fail to either close their business or to disperse a mass gathering.
Next question, also from Jessica Dyer at the Journal, is can you define what you mean by adequate supply of PPE for the fire department?
Okay, we'll hand that one over to Deputy Chief Jaramillo.
So what we consider a full complement of PPE on a COVID-19 call is goggles, face mask, an N95 mask, gloves, and a gown. So we daily inventory the amount that we have. We have enough backstock to carry us through several weeks in certain areas. And so we have a little bit more of certain things, like we have a track of all that. So we are also keeping track of our burn rate. So our burn rate is how much we use every day. And so we are burning less than what we have in stock. So we know that we can continue moving forward with that full PPE with what we have. We're actively working on securing PPE from other sources through our work with the EOC, and then some internal work in the fire department and our vendors. So the vendors will send us, boxes of gowns, for example, every so many days when they have it in stock. So we just keep acquiring more than we're using. We're not hoarding PPE either, because we're sharing the stash with everybody else, hospitals and other agencies that also need PPE. So we have enough to continue to outfit our firefighters on every COVID-19 call, while we continue to order more to replace what we're using. And a part of that too is we're also using a scout system. So we have 4 people on a fire engine. Not all 4 firefighters put full PPE on every call. So on calls, we'll send 1 firefighter in. They will make contact. We try to encourage people to meet them at the door, come outside in the open air. And so people making direct patient contact might be in full PPE in an effort to conserve what we have. So not every single firefighter is going to be in that PPE, but they're also going to be standing back. Thank you.
Okay, we have one more from KRQE. Can you clarify the difference between a warning citation and a monetary citation? Is there a difference?
So the question is, what's the difference between a monetary citation and a warning citation? So we do have a protocol developed for this, so our lieutenant can field this one. I do want to also follow up on what our deputy chief mentioned in terms of PPEs. The county city joint information or joint operations center actually tracks this for all key entities around the city. So want to remind folks that we're actually doing this in full coordination with our hospitals, with the county, and with every critical department, and running that balance between extra supply and also rationing what we have. And so that's a live database that is on the big screen whenever you walk into our EOC. Okay, on the second question, Lieutenant.
Thank you, Mayor. So again, Mayor Keller kind of showed it, but here's our verbal warning or our written warning. So this is essentially a written agreement between the business and the enforcement entity, notifying them that they are deemed non-essential. They are still operating a business not in compliance with the governor's order, and we get a signature from the highest ranking person in that business, and we keep this on file. So again, we have a central intake where the state police, the Albuquerque Fire Rescue, and code enforcement all compile their data into one source. So we all have, if one business has been visited by state police and issued a warning, they're still operating, APD goes out, well, now we're gonna up it to a citation because they've already received the warning, and we have documentation for that. So the warning that we're using is under New Mexico State Statute 24-1-17, which gives us the authority to enforce the governor's safety mandate. We're also using New Mexico State Statute 30-8-1, which is a public nuisance ordinance or state statute, which allows us to issue the citation for businesses not adhering to the governor's order. So, and again, those fines will continue, the citations will continue until the business comes into compliance. And as the mayor stated earlier, we will encourage compliance one way or the other.
Also from the Albuquerque Journal. When did AFR start its direct transport of patients to the hospital? You mentioned that approval through the PRC.
Question is about the PRC transport, but also kind of what we've been doing beforehand. There are some rules around this, and DC Armio knows all about them.
That could take an hour to answer that question. So AFR has always been able to directly transport to the hospital, even prior to today when the PRC approved our certificate. So it was linked to certain instances that were outlined in our contract. We had limited transport authority, meaning that we could transport in ways that us and Albuquerque Ambulance had put into our contract. So, for example, if it was a critical patient, somebody having a heart attack, and we were there first and we needed to get them going, we could put them in our rescue, our ambulance, and transport them to the hospital. So we've been able to do that for a very long time. What this certificate does is it gives us the full authority instead of the limited authority, where we're no longer bound to transport with that contract in mind. As far as how those changes are going to look in the future, those are things that we've talked with our partner, Albuquerque Ambulance. We're such a busy system here in the city of Albuquerque that we don't feel like one entity can do it alone. And so we've said from the beginning of the pursuance of this certificate that we would work together with them moving forward on a way that just created more efficiency in the 911 system. So that's kind of our plan moving forward, and today is kind of that starting block for us to start working those things out.
Okay, and one final question. From KRQE News, has anyone been fined?
One other question, has anyone actually been fined? I believe we have one. So it was our smoke shop, so they've been fined. Yeah. Okay.
If they, because I know you stated that you'll continue to issue citations. So let's say if a business is just not listening at this point, is the final thing to just shut down? Like, would you just close that business down?
Mm-hmm. So Lieutenant can speak to this, but the fines, also we can do them as much as we want. So they do add up and will have to be paid. So at a certain point, you close them down one way or the other, financially or physically. But anything else you want to add?
Thank you, Mayor. So the plan that we have in place concerning the fine, so every fine, once a day if they're continuing to be open. The Rags to Riches smoke shop may or may not be open still. And we are going to issue them another citation as we did yesterday. So we're going to issue them a citation every day that they remain open. We're going to compile that data. Each citation is a new incident, and all of that data is going to be compiled and sent to the Attorney General's office for prosecution. So yes, like the mayor was saying, one way or the other, they will come into compliance.
Okay. All right, we will see you tomorrow, and let me just close by, because a lot of them are here today too, just thanking all our first responders. I know everyone is pitching in different ways. Some days we focus on our grocery workers and our truck drivers, but just really appreciate everyone's work in terms of our first responders, and want to echo what the doctor said. I'm proud of Albuquerque. I think we're doing a good job. We need to keep it up, and we need to do a little bit better. That's the message today, and but it makes me proud to be Albuquerque's mayor. Thank you so much.